Good morning, doctor. What is Alzheimer's disease?
Okay, when we talk about Alzheimer's disease, first of all, let's talk about the whole spectrum, which is dementia. So dementia is a group of diseases wherein you have impairment of intellectual function and memory. And Alzheimer's disease is only one section of that group of diseases under dementia. So Alzheimer's disease, it makes up about 60% of cases of all the different types of dementias. Because we also have other types. You have vascular dementia, okay? We have secondary types of dementia, secondary to tumors and things like that. And we also have what we call the combined vascular plus Alzheimer's dementia. So in Alzheimer's dementia, this is a type of dementia wherein the patient has multiple cognitive deficits. So they have memory impairment, there's inability to follow mga commands, okay, they lose initiative, they have a lack of emotional control, poor judgment. So basically, they are unable to carry out the usual activities that they were able to do in the past. And then, of course, yung insight nila, yung judgment nila, your thinking is also affected. And when you say it's Alzheimer's disease, it's because there's one particular abnormality in the brain. The presence of abnormal neurofibrillary tangles, that's what we call it, in the brain. And this is the hallmark of Alzheimer's disease. Clear ba? Okay.
So, what causes Alzheimer's disease?
So, as I was saying kanina, Alzheimer's disease is caused by, parang there's a degeneration of the proteins in the brain. And then they cause parang tangles. Okay? They call them plaques and tangles. Yung plaques, para mga scar in the brain, and then the tangles, the proteins are all, instead of being laid out properly, they're all bundled up so that there is abnormal communication already between the brain cells. And because of that, the patient is not able to think and perform properly. That's just putting it very simply.
So, what is typically the first sign of Alzheimer's disease?
Typically, the first sign would be memory lapses, okay? So, forgetting where they placed some things, and basically misplacing things, and then not making it to appointments, things like that. And then it may get progressively worse, not being able to recognize people that they knew before. Some patients may have some behavioral changes na they become not naman combative, pero para bang they don't want to follow what's the usual norm. Okay, so in some elderly, you may see ayaw nilang maligo. Okay, they don't want to eat. Okay, so some behavioral changes. Okay, medyo progressive yun.
So, for example, if a family member has Alzheimer's disease, will I get it too?
It's not 100%, but Alzheimer's disease kasi mataas ang hereditary component. Okay, because there's a certain protein or a certain gene, which you inherit. And when you inherit that gene, you are going to be more likely to develop Alzheimer's than somebody in a family na wala yung Alzheimer's. So it has what we would call a familial tendency.
So, how do we prevent Alzheimer's disease?
Okay, so actually, we see changes in the behavior, in the memory, when the patients are older already, 60, 65 and above. But in one of the recent conventions I attended just last May in Australia, they noted that the changes in Alzheimer's actually start when you're as early as 40 years old. Okay, so that's why they encourage mental activities. That's one way, The brain is like a muscle, you exercise it, and if you do a lot of thinking activities, puzzles, analytical things, and so on, it will actually help delay the onset of the symptoms. And in some, they have this study now that in patients in whom there's a very strong family history of Alzheimer's, they might even start some medications earlier. Not the usual recommended 60 years old na start medicines. They may even recommend it as early as the 40s or the 50s.
So, how do we cure Alzheimer's disease? see.
Number one, Alzheimer's is not curable. Okay, we can only delay the onset and the progression of the symptoms, slow them down, but you cannot bring the memory, the behavior back to the previous. Okay, so if you're talking about Alzheimer's disease per se, we can give medications. We have several types of medications. We have anticholinesterase agents. Okay, so these are given to increase acetylcholine levels in the brain. This is a neurotransmitter, so that with that you enhance the communication between the nerve cells, and that will prevent the deterioration of the memory. Okay, but again, it will not bring the patient back to normal. Okay, slow it down lang. There are also other medications like yung samples na anticholinesterase inhibitors. You have your rivastigmine, you have your donepezil. Okay, then we have other medications also like memantine, no, which are also for memory. Now, there are some studies coming out about ginkgo biloba. Have you heard of ginkgo biloba? It's actually an herb. No, it's an herb, comes from the ginkgo tree. The leaves, no, there's a certain extract from that, which is which enhances blood flow to the brain, and which they are studying pa lang. Hindi pa confirmatory ang studies, but they're studying it as an adjunct to treating or sustaining memory.
So how should people cope up with people with Alzheimer's disease?
Okay, that's going to be difficult. Okay, because Alzheimer's is not going to be a burden only on the patient. It's going to be a burden also on the family. Okay, and here you need a very strong emotional support for the patient and even for the caregivers, kasi some of the caregivers will burn out. They will fatigue from taking care of patients with Alzheimer's, especially those who are combative. Okay, there are patients who before were very docile, very meek, and then all of a sudden when they develop Alzheimer's, they can become aggressive, they can be loudmouth, they can even start cussing, things like that. So for people who take care of patients with Alzheimer's disease, of course, we have to make sure that first of all, the medications are right there. So aside from medications for the Alzheimer's itself, which are your anticholinesterases, we might need to give antidepressants, we might need to give tranquilizers, depending on the behavioral problems of the patient. Then, those who take care of patients with Alzheimer's should also make sure that the patient is given adequate nutrition, because sometimes nutrition can be a problem. These patients, ayaw nilang kumain, or if subuan mo, they just pocket the food in their mouth, they don't swallow it. Okay, so it can be a big problem, both in terms of nutrition and hydration. So some of these patients may ultimately end up with tube feeding. So again, that is one of the things that you have to teach the caregivers, the people who take care of these patients with Alzheimer's, how to make sure that the patient is given adequate nutrition. Kasi their mental state is going to deteriorate more rapidly if they are malnourished and dehydrated. Okay. Then, of course, you need to have support, like I said, for the caregivers themselves. They should have ample time also to rest, because they can burn out. And they should have, alternating schedules. Sometimes it's difficult if it's like the family who takes care of the patient with Alzheimer's, kasi usually it will end up either it's the spouse who has to take care of the patient or one of the children. And sometimes resentment can set in if it's only one who is relied on to do a lot of the caregiving. So dapat within the family also there should be a lot of emotional support, both for the patient and the caregiver. The good thing in the Philippines is that we're able to get yayas, we're able to get caregivers who are salaried. So this of course lessens the burden on the family itself. Okay?
So that's all about that.
Okay.
Thank you.
Sige.